Hello everyone, Dr. John Bartemus here today with Functional Medicine Charlotte partner Sharon. And Sharon wanted to share her story with us. So Sharon, why don't you let us know why you first sought out functional medicine care?
I was dealing with psoriasis, had been for 4 years, but I had a really bad flare-up when I came to see you, and had been to the dermatologist, had been to my family practice, and was offered injections that I did not want to take. Mm-hmm. So I just Googled natural care for psoriasis, and you came up, and I read and saw some of your videos, and thought that was something I wanted to try.
Excellent. So I'm glad you did. And so where were the psoriatic lesions?
Well, before this last flare-up, they were mainly on my legs. Mm-hmm. Could be hidden, mm-hmm. really, with my clothes. This last one, they were all over my arms, in my eyebrows, on my ears, my back, everywhere. And I couldn't really hide it. So they were everywhere.
Hence the urgency of finding help.
Yeah.
Okay. So you reached out, and we went through the functional medicine process. So how was your experience in terms of like assessment and figuring out what's going on with you? How is that different than your experience with other doctors previously?
Well, I know that psoriasis is autoimmune, mm-hmm. and although I'm not a doctor, I know that autoimmune is driven by inflammation. Mm-hmm. And I like that you did not say, let's clear up your skin. Mm-hmm. You said, let's find out what's causing your inflammation and treat that. And that's what you did.
Yes, excellent. So the paradigm, or the just how we approached you as an individual was different. Awesome. So we went through it. We found what we thought were the causes of the inflammation, and we implemented care. And so what came of it? How's the psoriasis?
It's clear. Do y'all see that? It's clear.
And we'll have pictures of pre and post that I'll plug in the video here.
It's I would say probably right now 90% clear, mm-hmm. But I'll take that.
Yeah, absolutely.
Yeah.
And so what's interesting too, if I may share, is recently you had a life circumstance, or a couple of them, that would anyone would agree would flare psoriasis by driving up inflammation. And so how did you do in those circumstances? How did the skin do? Share a little bit, if you don't mind, about those.
Well, my husband was in the hospital for 5 days from a little something on his finger that grew into a great infection. And if I still had been flared the way I was, I probably wouldn't have even been able to be in the hospital with him, because he did have a pretty bad infection. So.
And it was MRSA, so if we walk in with open psoriatic lesions, probably not good. You might have a couple in the room dealing with that infection. So you were able to go and spend the week with them. So that tells us about the improvement and robustness of your immune system right now to have the lesions clean enough to go to the hospital and spend the week there and leave without MRSA.
Without MRSA.
Yeah. So that's excellent. And so what would you say if you spoke to someone out in public who said, yeah, I've heard about it, but I hear it's hard, or it's expensive, or, how would you encourage somebody toward a functional medicine?
In my situation, yes, it was expensive, but in my situation, I had to consider the cost of the injections, mm-hmm. and possibly treating problems that the injections may have caused.
Yeah.
And none of it was hard for me. The most difficult part was probably learning how to eat 3 times a day, because I didn't. But I had to take the supplements. But to me, this was a great experience. He's going to show some before and after pictures that I may not be comfortable with, but if it would encourage somebody else to seek functional medicine,
yeah,
you can do that.
Thank you. We appreciate it, and that will really help people out there, because when they see you now, they may not believe that, oh, hers wasn't as bad as mine, but when you see the pre-pictures, I mean, they're legitimate psoriatic lesions. So I want to say thank you for the opportunity to partner with you. Excellent job in implementing all the things you had to implement, because it's not as easy as going somewhere and getting an infusion once every couple weeks. You actually have to consistently, all day, every day, make the right choices. But if you do, the potential is there that you're saying I'm 90+% cleared. So excellent job there. High five.
Thanks.
And keep up the good work.
All right. Thank you.